What are exon-skipping therapies in muscular dystrophy? Have you ever wondered how scientists are working to tackle muscular dystrophy? One exciting area of research is exon-skipping therapies. These therapies are mainly focused on Duchenne muscular dystrophy, often referred to as DMD. DMD is a severe form of muscular dystrophy caused by mutations that disrupt the production of dystrophin, a vital protein for muscle function. Exon-skipping therapies use small pieces of synthetic DNA or RNA, known as antisense oligonucleotides. Think of these as molecular patches that help modify how the cell processes the dystrophin gene's RNA. Specifically, they cause the cellular machinery to skip over certain faulty sections of the gene, called exons, during RNA splicing. By doing this, the therapy can restore the reading frame of the dystrophin gene, allowing the production of a shorter but partially functional dystrophin protein. This can potentially reduce muscle damage. In DMD, most mutations lead to an out-of-frame deletion, which means the body cannot produce functional dystrophin. Exon skipping aims to convert these out-of-frame mutations into in-frame deletions, similar to those seen in Becker muscular dystrophy, which is a milder form of the disease. This conversion allows muscle cells to produce a truncated dystrophin protein that still has some function, which may slow down disease progression and improve muscle strength. The way this therapy works is by delivering antisense oligonucleotides that bind to the dystrophin RNA. This binding blocks the inclusion of specific exons during the splicing process. By masking these exons, the cell effectively skips them, restoring the correct reading frame of the gene. Different antisense oligonucleotides target different exons based on the patient's specific mutation. For instance, skipping exon 51 could potentially help about 13 to 14% of DMD patients, while skipping 1 or 2 exons might address up to approximately 83% of DMD genetic mutations. It is important to note that exon-skipping therapies are not cures. They representing a form of personalized medicine that can help lessen the severity of muscle weakness and atrophy. Clinical trials have shown that these molecular patches can increase dystrophin production in muscles and are generally well tolerated. However, some side effects, like skin and kidney issues, have been reported with certain formulations. There are several experimental approaches to exon skipping. The most advanced method involves using antisense oligonucleotides that bind to RNA to modulate splicing. Other methods include using viral vectors to deliver modified small nuclear RNA or even genome editing techniques like CRISPR, which are still in early research stages. The effectiveness of exon-skipping therapies can depend on several factors, including the stage of the disease when treatment begins and the quality of the muscle tissue. Since dystrophin restoration happens after muscle damage has already started, it is still uncertain whether the newly produced dystrophin can fully replicate the function of naturally occurring dystrophin from birth. Ongoing research aims to better understand the relationship between dystrophin levels restored by exon skipping and clinical outcomes. In summary, exon-skipping therapies for muscular dystrophy offer a promising genetic treatment strategy. By modifying RNA splicing, these therapies aim to produce a partially functional dystrophin protein, transforming the severe Duchenne muscular dystrophy phenotype into a milder Becker-like form. As these therapies are mutation-specific and under clinical investigation, it is essential for patients to seek personalized advice from healthcare professionals specializing in muscular dystrophy.